Well, hey y'all. Welcome to Crawford Family Chiropractic. My name is Dr. Patrick Stull, and we're going to talk and show a little bit about dry needling. So a lot of folks are like, dry what? Well, needles, right? We take really small needles once you take them out of this package, and you once they come out of that and they're ready to use, very clean, very sterile in that. They're very tiny, so they're what called solid filament needles. So versus a hypodermic needle, they don't shoot anything through. So the dry needling just shows the difference between this versus getting a shot with like lidocaine or something like that into the trigger point. So speaking of trigger points, that kind of brings us into why we would do dry needling. So we are looking in the muscular system for those knots in your muscles. So we call them myofascial trigger points. So this is a good way to release those. Trigger points will cause pain. They will cause elbow pain, shoulder pain, neck pain, headaches. So we have Emily here, and we're gonna deal a little bit with her upper neck and headaches. So tension headaches, right?
Yes.
Really common area is up in the neck area. So we're gonna look for some of those trigger points, and as we find them, we will put a needle in there like this, and want to see that trigger point release, want to see it let go, want to see the muscle relax, and that helps tremendously with, in this case, headaches. And of course, you see me wearing gloves, so we're always very cautious, very clean, and we're using alcohol swab to clean the area before we do any of the needling. And Emily, we did this once with you before.
Yeah.
How did that go?
It was great. It took away my headache for a couple weeks.
Oh, awesome.
Now I'm just getting a refresher.
So some people might think, hey, this is pretty painful. It's a needle. Needles freak me out. I understand that. It's a very common fear. Very small needles though. You typically don't really feel them going in like you would a shot. As far as comfortable, not comfortable, if you're hitting a good trigger point, an area that's pretty tight, sometimes they'll be a little sore when you're needling them. Were you sore after last time?
No, actually, it didn't hurt really at all.
Okay, awesome. Alright, so we're gonna get started. And you can see that needle is encased in that plastic, which is allowing it to be super clean, very sterile. And then once we put the needle in, we'll kind of move the needle up and down, and part of that's just getting that muscle to relax. So this differs from other techniques, other massage techniques, myofascial release techniques, because it can penetrate deeper, right? It can get down into some of those deeper trigger points that you can't always get to release with massage or other forms. So a dry needling treatment doesn't necessarily take long. It's very individual basis. Depends on what we're working on, but it's pretty quick. Needles are in and out. Other forms of this, some people might leave the needles in and hook them up to like an electrical muscle stimulation unit. You can do that, but it does differ from acupuncture. Acupuncture will usually place the needles in a variety of acupuncture points, and then they will typically leave those needles in for 30 to 45 minutes.